Hi everyone, my name is Devi. My project is on aspirations precautions with GI meds. The purpose of aspiration precautions it is to prevent aspiration of GI medication, fluids, or gastric contents into the airway, reduce risk of aspiration, pneumonia, and respiratory distress, promote safe and effective medication absorption, protect patients with impaired swallowing, reflux, or decreased LOC. Patients that are high risk for aspiration are dysphagia, stroke, Parkinson's disease, ALS, GERD or hiatal hernia, decreased level of consciousness, elderly patient, tube-fed patient, post-anesthesia or sedation, and neuromuscular disorders. The common GI medication requiring aspiration precautions are antacid, H2 receptor blockers, proton pump inhibitors, and antiemetics, and also laxative and stool softeners, GI motility agents. The nursing assessment before administration assess the gag reflex of the patient and their swallowing ability, evaluate level of consciousness, and check for nausea and vomiting. Also review history. Aspiration precaution during medication admin. Make sure you put your patient in the high Fowler's 90-degree angle. Administer medication one at a time. Use thickened liquid if ordered. Avoid straw unless approved. Encourage slow swallowing. Stay with patient during administration. And also for special considerations for oral medication and two feedings. Put the description there. And for post-admin care, make sure you tell your patient to stay upright for 30 to 60 minutes. Monitor to see if they're coughing, choking, or wet voice. Assess the lung sounds also. And document patient tolerance. And these are the signs and symptoms of aspiration. Coughing, choking during meds, gurgling or wet voice, shortness of breath, cyanosis, fever, or crackles later. The nursing intervention, if aspiration occurs, stop the medication immediately, position patient on one side, suction airway if needed, notify provider, monitor oxygen saturation, and document incident. And for patient and family education, make sure you tell them to sit upright 90 degrees when taking the medication, one pill at a time, do not lie flat, and report if there is coughing or choking. Documentation requirement, medication given en route, patient positioning, swallowing ability, any adverse reactions, aspiration and precaution implemented. And the next video is a demonstration that I did with my pretend patient. Okay, I'm going to demonstrate how aspiration precautions with GI medication works. I have here Mr. Smith, my patient. It is time for his medication. He has dysphagia, so I need to monitor him when he took his medication. Okay, first step, I'm going to hand hygiene. I already washed my hand before, and I'm going to provide privacy. And I already double checked his identification. I already verified it. And Mr. Smith is supposed to be in a semi-Fowler's position, which is 90 degrees, but seems about right. The position, I can't move the bed. Okay, so Mr. Smith is done for medication. Okay, so he's gonna take his medication with a sip of water slowly. And then he's mad, and he's gonna take a sip of water. And he cannot lay down. He has to sit in the same position for about 30 to 60 minutes to prevent aspirations. Thank you. Okay, I'm gonna demonstrate how aspiration precautions. Thank you.